Can everyone hear us? We'll just wait for everyone to just settle down. You guys can already see what the theme for our session is. We, of course, want to thank Times of India for continuing with their series of Right to Excellence. This is the Health Summit, and it's an absolute honor to be moderating this panel with this distinguished guest. So I'd like to first thank all our guests for taking out the time and joining us this evening. Because we have a limited time, I'd like to divide the session in a way that we understand where we stand first, what are our challenges, look at what the opportunities are, and eventually what are our solutions. So by the time we end, we at least know where we are headed once we wrap up this session. So Amrita, I'd like to begin things with you. When we talk about transforming health, I want to first understand, before we get into techniques and solutions, does it need to begin from a change in perspective? Am I right to say that we need to first begin from a change of a sickness perspective to a wellness perspective? If we start thinking that way, if we start approaching health that way, do you think half the job is done?
No, 100%. And thank you for that, Ridhima. I think that I have to clarify, I'm probably the only non-doctor on this panel. So if my mother ever watches this, she needs me to say that up clear. I used to be a health editor, and then I work a lot in the mental health storytelling space. We've done several books. From what Ridhima asked, I think one is a perspective change as individuals, but two is we're all stakeholders, right? So whether we were in the media, whether we are in different, where some of us are in policy, some of us, of course, in the healthcare system, when we start looking at, I think, health overall, and definitely mental health, we do need to be looking at it from this lens of sort of agency for the person. We do need to start looking at it as everything being connected, as we just heard in the previous panel. And I think we do need to look at it in terms of what are the preventive measures that we can put in place. And 100% I can tell you this for mental health. When we look at the numbers and so on, I did an interview with Dr. Vikram Patel several years ago, who said, according to the numbers, 1 in 10 Indians has a severe mental health disorder. But that doesn't mean the rest of the 9 of us are doing well. So we all have mental health. We all owe it to ourselves, to sort of be the guardians of that mental health, as he and several others put it. And I think, Ridhima, framing that in a way that doesn't make it about us and them, because for mental health, definitely we try to talk about stigma, but that stigma starts with and ends with each one of us. So there is no us and them when it comes to mental health. We all have it.
I think that's a brilliant start. Just the way we approach health, I think that has been a concern over the last few years, because as I said, if you move from a sickness perspective, you see this as a burden, you see this as something dirty, as something unfortunate. If you have that change, then half your battle is won. But Dr. Khosla, and we were chatting before the panel started, it's all great to talk about transformation that is needed, the potential that is there, but none of that can be done without us understanding where we currently stand, which is what are our challenges. The Indian healthcare space, despite the kind of work that has been done, has some very grave challenges that I think we need to understand, which is just your doctor-to-patient ratio, the kind of accessibility that people have, low insurance rates. How do you make health and eventually wellness accessible, affordable, more inclusive? Do you think that's the pressing challenge for us to understand first?
Yes, first of all, these are very valid questions, and thank you for asking such pertinent questions, because there has been almost like I would say, an infodemic in the last 2 or 3 decades with respect to health, information, and in particularly my field, which is nutrition and diet, food-related issues. So there, we all began at one point saying that we need to educate the public, as though they were illiterate or as though they did not know enough. And sadly, we went wrong there, because we as a nation in India have a treasure of tools to deal with ill health, which somehow got overshadowed because of various reasons, including the so-called, we have a scientific viewpoint on everything. So I think that became unfortunate, because we, instead of combining the two, instead of complementing, we began to replace our traditional practices. And just to give you an example, I was just talking to my daughter-in-law, and she was telling me about how, in pregnancy these days they have skin to skin, and they have, so many scientific aspects to 40 days of whatever. So I said, you're lucky, because in our times, all these had become scares that, you can't massage a child, you cannot, it'll give him a rash, it can dislocate a joint, so don't do these things. And today we're turning it all back and finding scientific explanations. So I think that was unfortunate, and I can give you hundreds of examples in food where we've taken a U-turn, right from saying hot and cold foods are myths, but today we know that they exist and there are constitutions, and this was all a part of our wealth. So I think that is, I can go on and on, so I don't want to take too much time explaining this. So that is a challenge, and I think the solutions lie somewhere in between, just combining modern medicine and using modern medicine to validate what existed with us through Ayurveda and our texts, and rather than saying, oh, this is just non-scientific. So that's one. And I think the approach really has to change, like she just said, that it's preventive rather than curative, holistic rather than speciality-based medicine. That needs to, and the root cause approach, which has also not happened. We just begin to say, oh, I have a headache, I have a migraine, just pop in a pill. But why did it happen? Or why did my diabetes happen? Getting into why did I have a thyroid cancer? Why did I have a thyroid problem? Why did I, et cetera, et cetera, et cetera. So once we get into the root cause approach, we will be able to handle this entire ecosystem far better and far more efficiently with less cost.
So a couple of interesting points that Dr. Khosla is pointing out, and I'll get to what she said, that how do you move from this entire habit of popping pills, and we're all, used to it, to a more wellness perspective. But I want to take on from what she said and bring Dr. Madan Lal also in the conversation. So essentially what Dr. Khosla is saying, that this is possibly the time, and what really wanted me to do this panel was also how the entire summit was themed. Usually you see a lot of health summits just focusing on health and disease, but not many want to focus on the idea of wellness. So Dr. Khosla is saying that maybe it's time to find that middle ground. You bring in your age-old traditions and your modern techniques. So essentially, Dr. Madan Lal and Dr. Khosla have to meet in the center. That's the balance that we're looking at. Do you think we're on the right track, Dr. Madan Lal?
Thank you. It's a very interesting question, because if you see that journey which the public health has traversed over the last many, many years, the definition of health was very, very difficult, because after the constitution of World Health Organization, it almost took 40, 50 years to arrive at a consensus that health is a state of, though it is a state, they are still saying it's a state of physical, mental and social well-being. It has to be a dynamic process. That's a different debate. It was an Alma Ata declaration where it was agreed that now we are moving from disease to the health aspect. Having traveled that journey, because health for all, the slogan was given, from that we have moved to the wellness aspect, the Millennium Development Goals and the wellness was there. And if you look at the strategies, how the strategies were built around, the whole focus was on primary health care, which was having all the social determinants as well as providing services. Looking at the kitty which is available for the public expenditure, you see that the whole focus was on primary care. So as a result, you have seen primary care reaching to the people. A network of things have been created. Not the big, silver, aluminum, chrome hospitals, no. A small hospital, 30-bedded hospital, 6-bedded hospital, 100-bedded hospital, or 500-bedded hospital at the district level. That kind of system has kept in. But this was whole focus on providing health. Now from that, for the last 1 decade, now the whole focus from the primary health care is shifted to comprehensive primary health care. To add to the other burden, because there are 3 burdens we are struggling. One is the evergreen, the reproductive child health, that is going to be there. The other is the communicable disease, and the third is the non-communicable disease, including the mental health. So the strategy changed from just focusing on health. From disease, we have shifted to health. From health, we thought that there should be a wellness component, how the person should feel well. That's why the sub-health center, which were evolved for the last many years, they were converted into health and wellness centers. So we have now rechristened it and renamed it, because when we are talking about wellness, it has to be in the form of temple.
Correct.
So we are making it as a Ayushman Arogya Mandirs.
Yeah.
So wherein the wellness is now very much creeped into the system, the
Yeah.
public health, which was essentially focused on the disease. From disease, we were focusing on providing preventive, promotive health. Now we have gone a step ahead.
Yeah.
Now we are talking about the wellness aspect, and all the places wellness sessions are happening, be it yoga, be it
Yeah.
Zumba. In southern part, they
And
have
we're
the...
seeing the government also step in very proactively. If you look at the Ministry of Ayush, addressing concerns as far as yoga is concerned. So we've seen that directive shift, not just from people wanting to get in the space, but from the stake and policy holders as well. Dr. Nivedita, I want to get you in the conversation because we said we're speaking about wellness and making this perspective shift. So we're talking about making healthcare more holistic as well. The biggest concern, and I'm going to break it down very simply, is when you speak to somebody, who has a patient in their family, the patient sees themselves as a burden on the family, right? Do you think it's now time to move towards an approach where the patient can also become a part of their own care? So there is a more holistic approach of how you not just tackle the problem, but then eventually look at solutions as well.
Yeah, that's a smart question. Nicely framed. So, now when we have more visibility of the human genome, we know how the processes work, how the environmental stimulus is processed through particular genetic predispositions. So any disease is nothing but a result of interaction between your environment and your genetic predispositions. So having said that, it becomes very simple and logical that when you want to better somebody's health, it has to be an approach that looks at a better management of this interaction. That means environmental stimulus in the form of diet, exercise, mental well-being, emotional well-being, digestion, nutrition, all of this, hormonal. So when you talk about this, it cannot be a journey that is imposed on a patient by a physician because they know more, and because the client or the patient has been living with it, they know their individual uniqueness better than we do, and we have to open our mind to that possibility. We can definitely help them unlock, and they can help us understand that disease process and that individual uniqueness in them. And then they have to be a part of the journey together. And also when we talk about diseases which are more chronic, which is the rising type of disease because we're living longer, so then it is even more important because cure is a rarity. All you have to do is look at amelioration of the symptoms. And that can only happen with very direct interventions, very simple interventions, which are very easy for clients to understand. Diet, exercise, supplementation, and antioxidants if required, and mental counseling.
Yeah, I think that's very well put, and this is where I want to bring Amrita back in the conversation. Amrita, fortunately, we've seen that shift happen, which is 50 years ago, health meant physical health. Either you have to have an unfortunate accident or a long-term illness. Fortunately, with more awareness, more education, more conversations like these, we've understood that's a very restrictive way of looking at health and eventually wellness as well. You're somebody who champions the cause of mental health very well. Kudos to the kind of work that you've been doing. One of the concerns that come in, whether it's physical health or mental health, is one, the lack of help. Where do you begin? A sense of loneliness. You build a sense of community for those people to feel that they're not alone. Could you talk to us about why that becomes so important? Because if you help one, they will help 10. Is that the idea that you work with?
Yeah, that's actually a great way of putting it. I think that they is us, by the way. So I feel like we're all a member of a community. And what's ironic is in this age where we're all hyper-connected on social media, we are actually facing the brunt of isolation in real life. And there have been studies about this. You're seeing the impact on young people, but also older people. I think the phrase mental health puts off a lot of people, but once we start the conversation, we've been, wherever we've been talking, including at Lit Fest with our books and so on, we have older people coming up and saying that, as Indian societies have changed, there's a lot of guilt now because folks aren't able to do the caregiving they were doing earlier. They don't know where, as you've been hearing, when people are living longer and longer, how do you still have that sense of community when your family is elsewhere? So there's acute loneliness, there's definitely guilt, there's that sense of isolation. Younger people don't always know how to communicate with other people about what they're going on. In a way, the pandemic, which we heard Dr. Seth talking about, the pandemic actually made us mainstream some of these issues. And we started learning this vocabulary. The mainstream media started covering a lot more of what's happening. We heard from marginalized communities, by the way, that some of them had to go back to families that may not have been welcoming, and then they found their people online. So one thing I usually tell people is, sometimes you look at the scale of the problem, and in India there's no dearth of problems. So if you look at health, there's always huge numbers, and you feel there's nothing I can do to make a difference. But every single one of us in this room, and it's not just about sitting on a stage, every single one of us can learn to be more empathetic. We can learn to listen. We can learn not to judge. And I think simply saying, be kind it's an easy thing to say. It's hard to put into practice. What we started seeing with this community, and the Health Collective actually started with a repository of information and helplines. People started sharing their stories because they said, this is 7 years ago, there's a place where people care about our stories. That spread through word of mouth. So I do think that for each of us, one powerful message has been, whatever you're going through, and especially when it's mental health, but even physical, when you go through a disease, you can feel very isolated, you can feel very alone. So for us, that's more than a hashtag. We say you can find people who are going through what you're going through. Just remember, you're not alone in this.
Yeah, oh, absolutely. And there are helpline numbers that are available. There are online platforms. We'd be happy to give you more details if anybody does want. But Dr. Khosla, I want to understand from you, as Amrita is saying, that we've seen that perspective change where people are more aware that it's not just about clocking those number of steps or, hitting the treadmill, but a lot more. You're somebody who's been, again, championing this cause for years. You were talking to us about case studies of as young as 15-year-olds, 18-year-olds coming to you. Parents took them to every possible doctor. They've been popping pills, but it's eventually a more holistic approach to their lifestyle, wellness, nutrition, medicine that eventually helped them come out of it. Today, when we speak about wellness, we speak about nutrition, exercise, meditation, but the concern for many also is that I understand all of this in isolation. How do I get all of this together that this becomes a part of my lifestyle?
Yes, I just go back to what I spoke about, the root cause approach. And really, if you get in to that space, it answers everything. Hippocrates, the father of modern medicine, 2,500 years ago, said something very simple, that all diseases begin in the gut. Today, modern science has shown something so simple by demonstrating that in the gut we have trillions of microbes, the microbiota. And they hold the key to whether we are ill or whether we are well, whether we are depressed or whether we are vibrant and happy, whether some genes will be expressed or silenced or dimmed. Literally, whether I'm going to sleep, whether I'm going to not sleep, whether I'm going to be obese or I'm going to be thin, whether I'll have a weight problem or I don't, whether I have diabetes, whether my cancer genes are going to be turned on. It's everything. And today, Dr. Alessio Fasano, who's almost like a potential for the Nobel Prize, has gone on and said that almost 300 medical conditions are linked to what we call the leaky gut. And some of the grains that we eat every day are contributing significantly to the leaky gut. And these diseases go under different names: obesity, diabetes, heart disease, thyroid disorders, cancer, etc., etc. Nothing more powerful than that. So we really go back to what the ancient wisdom was and validate it through science. And today, when we talk about, when you said mental health, and we think it's it's a not so happy word, but I think it's time to say that it's all in the gut. We have 90%, 80 to 90% of the neurotransmitters, including serotonin, dopamine, tryptophan, etc., secreted in the gut, even melatonin. So, and the beauty is that, and I practice this in my work every day, I see transformations, literally transformations from, on some I shared with you, and in a span of like this. It's really, we never thought, I come from the mainstream nutritional background, but as students, we never thought of, nutrition science that we'd be able to do so much.
Yeah.
So
I like what Dr. Khosla said. We usually say it's in the head, but now it's in the gut.
yes, it's the second brain. It's actually called the second brain.
Because, we've reached the end of the discussion. As I said, we would now want to understand modern techniques and solutions that are needed to transform health. So Dr. Madandal, I want to understand from you. Dr. Khosla is talking about wellness, nutrition techniques. Talk to us about the potential of the healthcare industry today as far as modern technology is concerned, as far as preemptiveness is concerned, because I think that becomes the operative word. Sometimes we reach the hospital, it's far too late. Is there technology that's helping us to save time today?
You see, there are two major things which have happened in the medical field. One is the use of sensors, and the second is the biomarkers. It has revolutionized the way the medical practice used to be. The modern medicine which everybody talks about, it used to be traditional medicine 40, 50 years back. Because it has been adopted by many people across the country, that's why it has got the status of this modern medicine. Otherwise, in some parts of the world, before it was introduced, it used to be traditional medicine. So we have to always remember that fact. Second thing, you have talked about the technology. Now you see increasing use of technology. And COVID is a glaring example how we have used the technology. Despite not having beds, when the system was overwhelmed for 3-4 weeks, it was a technology which has helped us. From control rooms, we have moved to the command and dispatch functions, and now you solve that key, communication centers. Then home-based care was happening because of technology. The pulse oximeters and the digital thermometers were there. And with the aid of the teleconsultations and other things, you see that how we have leveraged the technology. In the coming days, for addressing the issues of accessibility, affordability, and other things, we would be using technology. If you take the example of the other alternative medicines also, see how the technology is being used. They also use the technology, sensor technology, for actually mapping the Vapa, Vat, Pitta, and Kapha dosha, and they make charts. Based on that, the wellness activities and other things. And in the coming days, you will be seeing a lot of wellness activity because everybody wants to be well. But it's very difficult because it took 40, 50 years to arrive at definition of health.
Yeah.
It will take another same 4-5 decades to arrive at a definition of wellness.
Yeah.
So first we have to be well-being, then we can talk about the wellness. Because very fluid situation. It's not that I can be well. I may be looking very stout and this, I may be having metabolic disorders, but my mental agility and other things, it's very difficult to match.
Yeah, and I think
So
that's why...
you can't define that
Yeah.
who is healthy, who is not healthy. For some, the physical health is the health.
Yeah.
The other is the social health is the health. But from others, the spiritual or the mental health would be the health. But it's very difficult definition. But technology is going to come. If you're not into the technology, then you're not into the healthcare, whether it is traditional or whether it is modern.
Okay.
So the coming days would be like that.
Okay, but at least work has been done that we understand that we're on the right track. I know the clock has stopped, but Dr. Nivedita, I would want to end with you. As we said when I started that we want to understand where we are headed as well. Preemptive technology is something that people are very interested in simply because, as I said, you don't want to reach a stage where you feel it's too late in the day. The chronic patient burden is a real challenge for India, apart from some of the others that I listed earlier. Is there technology today, as far as preventive technology is concerned, to optimize your health in a way for chronic patients with chronic diseases, as well as for other diseases as well?
Yeah, so as I said, chronic diseases are very complex to handle because there is one organ system that's being treated, let's say, but there are numerous other physiological imbalances that could be underlying, and they coexist, right? So one has to look at improving the physiology of the patient so that they are better adept to dealing with that disease condition, which is a chronic condition. If they are feeling generally well, strong, they have vitality, and they are getting the nutrients, they're getting the physical exercise, and the right technological interventions, I'll name them in a bit, yeah, they will be better adept at dealing with the aftermath of the disease and the pharmacological interventions too. So this is as far as disease is concerned. Wellness is the extension of this itself. So technologies, I'm very happy these days because conventional medicine practitioners are actually referring clients to where I work as a functional medicine practitioner. It is the Wellness Co. So we are getting cancer survivors who come in for hyperbaric oxygen. We have IVF specialists recommending red light and also NAD therapies directly. And we usually, in cases which are sensitive like this, we do not intervene unless we are working in tandem with our conventional medicine practitioners, because either cannot work with the other, without the other. So that's how we do. And then whole body cryotherapy and nutritional supplementation by IV if there is a barrier in absorption from the gut. Yeah? So they are very foundational, and physical activity. And we have technology which is groundbreaking. You should study and read about it and be convinced and come asking for it rather than me trying to sell something and force it on you. Yeah? It's very promising, and it's all scientifically backed.
I think that's very well put, and that's also my cue to wrap up the discussion. So I think we wrap it up from where we started, which is what is that healthy balance that we can achieve with our age-old traditions and our modern technique. I hope you all enjoyed the session. Due to the lack of time, I don't think we'll be able to take questions, but our guests are available and they'll be happy to chat with you offline. Thank you to all our panelists. This has been an absolute pleasure.
Okay, thank you so much. Could I please request Ms. Nivedita Kavaria to facilitate all our guests and the speakers?